Welcome to the Gamut of Performance Podcast, episode 34. On this episode of the podcast, I get the pleasure of talking with Dr. Brent Brookbush of the Brookbush Institute. Brent is working on some really cool things at the Brookbush Institute from the standpoint of not only from physical therapy and training, but also from education. If you haven't had an opportunity to check out his website yet, I would definitely encourage that. This was a great conversation. So without further ado, here is Dr. Brent Brookbush. Brent, thank you so much for your time. Really looking forward to chopping it up with you. For some of the listeners at home, will you tell us a little bit about your background, your motivation, and kind of where you are?
Yeah, man, I think a lot of this stuff is already out there, but essentially I have a bachelor's in sports management, master's in exercise science, doctorate in physical therapy. I've been teaching for a long time.
Mm-hmm.
I think I'm going on 15 years now.
Okay.
I've published a lot of work, most of that available on our online education platform.
Mm-hmm.
So I've kind of been on the speaking and writing and education thing for a long time. Of course, I started my career as a personal trainer.
Okay.
And then later on became a physical therapist. So I kind of have both sides of that going as far as, the business side of things and what type of environments I've worked in.
Mm-hmm.
I think that's the biggest parts of it.
Yeah. Awesome. Okay, so what kind of made you want to diverge from personal training and move forward with your education?
Into like physical therapy you're talking about?
Mm-hmm.
I think as a personal trainer, I enjoyed it. It's a great job, and I found the corrective exercise thing kind of early on.
Okay.
So, I started teaching for an NASM-based program and the corrective exercise model that Mike Clark created through the National Academy of Sports Medicine.
Yeah.
And as my career progressed, I think I just leaned a little bit in that direction.
Mm-hmm.
I love beating up athletes, but it is hard to be a drill sergeant 8 hours a day.
Yeah.
I think it's a little bit more my personality to kind of be that thinker and to run through these more complex protocols and be a little bit more low key about the whole thing.
Mm-hmm.
A little bit more of a problem solver than, like I said, a drill sergeant.
Okay.
So I think that's kind of what pushed me in the direction. And then, of course, getting my DPT, like actually making that decision, comes down to a few things. Obviously, a physical therapy degree is a very broad-based degree, which gives you a lot of options.
Mm-hmm.
I have a lot of scope, so I can do just about any manual technique you can think of.
Mm-hmm.
I am saying scope-wise. I'm not saying I'm great at every manual technique.
Fair enough. Yeah, that makes sense.
And then, of course, a doctorate's a terminal degree, and I knew that was going to be important for what I wanted to do in education.
Yeah.
So I think the last point of that is as a physical therapist, even compared to some of the other manual therapy practices out there, like athletic training, chiropractic, physical therapy is a very stable position.
Yeah.
At any time, if everything went kind of upside down for me, which, I hope it doesn't, I could walk into a hospital and get a pretty good salary and benefits.
Yeah.
No problem. And I think long term, that is important. Like that stability is an important thing to have.
That makes sense. Okay. So will you elaborate a little bit on the Brookbush Institute?
Sure. So when I was coming up doing the education thing, and I started off training trainers for New York Sports Club and then Equinox and NASM, I just saw a lot of opportunity to make things better. Mm-hmm. And a big part of that came down to, I thought there was a lot of smart people out there who taught really poorly. And I don't mean to knock people per se. I'm not trying to say that these individuals are terrible human beings or that their intentions weren't authentic. It's more like nobody had really taken the time to add education science to lesson plan development of this topic matter that we were all teaching called human movement science, right?
Yeah.
So you have people who are talking, but they're not really grading themselves based on application and retention and comprehension. They're not really doing any thinking about lesson plan development or scaffolding or instructional design or, andragogical precepts and all these other things that kind of come into play when you start going, well, great, I have this student in front of me, and I know what I'm talking about, but how do I make sure that they leave with as much comprehension of what I'm talking about, as much understanding of what I'm talking about as I can possibly make happen?
Okay. So on that, what necessarily is a scaffolding, and then the other one, was it Andra something precepts?
Yes.
You lost me already.
Scaffolding is kind of a methodology for teaching where you're kind of thinking about how do I get from A to Z.
Okay.
And you kind of build step by step, and then as you build in these steps, you start removing some of the processes that help the student get there, so hopefully they become independent.
Okay.
Getting there on their own. So it's just like the scaffolding of a building. That's actually where the analogy comes from.
Yeah.
You put the scaffolding up to get the building up, and then you remove the scaffolding and hope that the building stands on its own.
Okay, that makes sense.
Andragogical precepts, Malcolm Knowles is an early researcher in education having to do with adult learning.
Okay.
The interesting thing is they're finding like a lot of these adult learning precepts probably work pretty good for kids too.
Okay.
But it's little things like adults learn better by associative learning, associating things with other things, which is where analogies come in really handy.
Yeah.
Than they do just getting dictated to.
That makes sense.
Adults want to have choice over the direction of their education.
Yeah.
Adults want to know how this stuff applies to the real world or their job, right? They get really frustrated. Kids do too, but adults get particularly frustrated if they think they're learning something that has no practical application.
Yeah. Okay. That makes sense. Okay. And then, sorry to have interrupted you, but so what was that kind of first thought you were initially on then?
Oh, just to, bring some of that into how we're teaching.
Okay.
I think, I can geek out about stuff like these predictive models of postural dysfunction, which is a big thing for me.
Yeah.
Or, trying to come up with a evidence-based integrated model of both rehab, and now we're working on that in the performance side too.
Okay.
Like that's all really great and really nerdy and obviously that uses a lot of brain power and it's cool stuff, but at the end of the day, like I know unless I can figure out how to communicate it well, it's not going to matter.
Yeah. That makes sense. Okay.
It's so there's a big drive about keeping these teaching principles in mind. We do a lot of training and development at the Brookbush Institute on communication skills and writing skills and public speaking skills. And it's all just trying to maximize clarity, maximize understanding, give students exactly what they need in the format they want it, in the format they learn best, to try to help every practitioner become a better practitioner. I think another important point is educators forget that they're not the goal. And what I mean by that is, we're not the heroes. Like, educators are not the end-all be-all. A certification doesn't mean anything. The only thing that means anything is the level of skill of the practitioner and whether they can do their job better.
Yeah.
In essence, I think there's an analogy in this book called the story brand, or building a story brand, that works best. It's like educators are not supposed to be Luke Skywalker. We're not supposed to be saving the world. We're not supposed to be the ones touted on pedestals. We're not supposed to be the ones that are, blowing up the Death Star at the end of the movie.
Okay.
What we're supposed to be is Yoda.
Yeah.
Right? Like, we're the people in the background trying to help the hero get to the finish line, which is you guys, right?
Yeah.
And the people you save are all of your patients who feel better, or all of your athletes who perform better and get that chance at a professional sport tryout or a college scholarship or whatever.
Yeah. That makes sense. No, I like that. I like that approach, and I don't think a lot of people necessarily think like that. So I think it's important to hear that perspective. And then kind of moving forward with that, right? So working with those clients, what does that kind of look like? What's the initial session, or what's like assessments look like? And you kind of touched on a little bit of earlier assessments of like postural assessments and predictive models. So what does an assessment look like first day for you with a client?
For me, okay, so I guess what we're trying to teach is, if we're going to talk about assessment, get rid of everything that doesn't impact intervention.
Okay.
So that would be the first step.
Yeah.
If it doesn't impact intervention in some way, and a perfect example would be the millions of terrible special tests out there.
Okay.
Right? Like, if it doesn't do anything to change the way you treat, stop doing it.
So what would be for some of the people at home, what would be a couple of special tests that are terrible?
McMurray's test.
Okay.
The NEAR test. Yeah, I mean, you pretty much pick a joint, and I can pretty much go down the list.
Okay, fair enough.
For a bunch of stuff that doesn't need to be done.
Yeah, fair enough.
In fact, there's a whole argument to be made that do we even need impingement tests, like shoulder impingement tests at all? Mm-hmm. And the argument goes something like this. Essentially, every shoulder dysfunction can result in impingement pain.
Okay.
So the specificity of impingement is essentially zero. If you get a diagnosis of impingement, then you know something's wrong with the shoulder. And that's it. So did it actually change the way you're going to treat? Probably not. Until you get more information, you can't really do anything with that diagnosis. All you know is the shoulder hurts.
Okay.
So get rid of shoulder impingement tests.
Yeah.
And if you start going down the line, you start realizing that you don't need a lot of the stuff that gets rammed into us at school. You know, we after we do any special tests that we think are I guess a subjective evaluation would be where it starts, right? Yeah. And special tests, if we think they're necessary, mostly special tests are going to be used for clearing an individual for intervention. Yeah. Right. So does this person need to be referred out before we even start? Okay. Then I would start with something like the overhead squat assessment, which is like a dynamic postural assessment or a dynamic transitional movement assessment, whatever you want to call it. And that's going to help me dial into what the compensation pattern or what segment of the body I'm going to key into to address this individual's symptoms or complaints. Yeah. And then from there we go into reliable assessments for movement, which would be, you know, goniometry for you know, I think your standard ranges of motion, things like dorsiflexion, hip internal and external rotation. If we were doing lower extremity, for example, upper extremity, internal and external rotation of the shoulder, or shoulder flexion. Like, these are reliable goniometric assessments. Okay. And then from there, I mean, if we really go back to that idea of only do those things that are going to change your intervention, that might be enough. You know, address movement and try to optimize motion based on those parameters. We could talk about manual muscle testing, but the truth is that if you did a dynamic postural assessment, most of the information that you would get from manual muscle testing you already got during your dynamic transitional postural assessment.
Okay. I like that. Okay. Fair enough. So kind of on that same train, do all abnormalities need to be fixed, right? So I know you said you work with a lot of general population, but also you've worked with athletes. So what's your take on that? So like in the case of, say, anterior pelvic tilt, right, do we necessarily need to fix that, or do we just need to teach the client how to control that?
No, you need to fix that.
Okay.
This is the biggest, and I cannot get more angry about something than this. Okay. Anybody who says that there is no evidence to suggest that movement impairment results in pain and increased risk of injury has not read enough research. The correlations are obvious, and then what people want to do is they go, well, correlation does not imply causation, and that is a very correct thing to say. However, there are about a dozen prospective studies that show things like knees bow in or functional valgus increase the risk of ACL sprains. There's a lack of reactivity in core muscle recruitment increases the risk of ACL sprains and low back pain. Right? So we're starting to get all these pieces of evidence that are showing that these impairments increase our risk. Yeah. And it's odd almost to hear individuals go, well, you don't have proof that, for example, rounded shoulder posture leads to shoulder pain. It's like, yeah, maybe I don't have the one perspective study.
Yeah.
Which perspective research, you have to understand at the onset, perspective research is very hard and very expensive.
Okay.
Talking about assessing a large group of people, monitoring them over a long period of time, trying to find a stable cohort that you can do that on. All of that stuff makes prospective studies relatively rare.
Yeah.
So, you go, okay, so you're saying I don't have a prospective study that shows that rounded shoulder posture increases the risk of impingement syndrome or maybe rotator cuff tear.
Mm-hmm.
But now what you have to argue back to me is that somehow the shoulder is different than the low back, knee, ankle that I do have evidence for, that somehow the shoulder is a magical joint in the body that acts totally different.
Okay.
What all this stuff really comes down to, man, and this is where I get so frustrated, is usually it's a political argument.
Yeah.
And it's all about the people who want to do corrective exercise versus the people who don't.
Okay.
It's all about the people who think movement impairment is a good approach to the people in pain science who think it's not.
Okay.
Right? So rather than taking an unbiased view and trying to integrate all of this stuff, they get, well, it's either or. It's not.
Yeah.
It's and.
Yeah,
the answer is always and.
Okay.
Right? So does movement impairment increase our risk of injury and pain? Yes. Is there pain science evidence that show things are more complex? Absolutely. I'm not arguing one against the other.
Yeah.
Ever.
Okay.
It's just the data, right? Like that. When it comes to research, all you can do is just look at the data and go, well, the data's the data.
Yeah.
You do.
No, that makes sense. Okay, so from a corrective exercise standpoint, right, will you elaborate a little bit on selection of corrective exercises? Because I feel like some people that may want to be on that train don't necessarily know what they're doing.
Oh, good. Well, okay. Which goes back to my point about education, which is where this whole thing started, right?
Yeah.
Education needs to be out there. I would say the biggest problem with the movement impairment and corrective exercise model, and it's really not a problem, it's just a barrier to entry,
okay,
is you have to have a solid foundation of functional anatomy.
Okay.
And I think that's where people get really messed up. Like if I see, for example, feet flatten, feet turn out during a squat, right? Then it's probably a pretty good idea for me to understand that feet flatten is eversion. That my everters are my fibularis muscles, that my inverters are my, the muscles that would oppose that, being my inverters are my tibialis anterior, tibialis posterior, right? And I need to know techniques for addressing the short and potentially overactive fibularis muscles, and I need techniques to address the long and potentially underactive tibialis posterior and tibialis anterior. And I think as soon as you start talking like that, people get a little, intimidated.
Yeah.
Right?
I've seen that, yeah.
And it's just muscles. And the funny thing is, and this goes back to those predictive models of postural dysfunction, which I've been working on, which are just, realize those are just extensions. Those are me trying to carry the torch a little farther forward from the Yonda up and lower cross syndrome, from Mike Clark's models with the National Academy of Sports Medicine and the CES model.
Yeah.
And of course there's a few other people, Kendall, Lewitt, Sarman, right? All these people. I'm just trying to carry the torch a little further, and especially now that we have all this research, we can make some good correlations. When you look at these models, you realize that what Yonda really hit on with upper and lower cross syndrome is, generally speaking, these dysfunctions are very predictable.
Okay.
Feet turn out, they don't turn in.
Yeah.
You know what I'm saying?
Yeah.
People ask me that, what if you see somebody's feet turn in? You probably have a neurological problem.
Yeah, it's have you seen that before? Yeah.
Yeah, I've never seen feet turn in.
Yeah.
That wasn't neurological in nature. So central nervous system dysfunction. And at that point, I'm referring out.
Yeah. I'm
a sports medicine guy. I'm an orthopedic guy. I don't know enough about stroke or spinal cord or MS or whatever to get into that stuff.
Yeah.
So sticking with sports medicine, if feet don't turn in, knees bow out or bow in, but they don't do other weird, crazy stuff. So all you need is a correction for knees bow in, a correction for knees bow out. What else? you have like an anterior pelvic tilt. People don't generally posteriorly pelvic tilt.
Yeah.
Right? So you get to this point where you see, okay, there's only a few patterns here, and maybe a dozen patterns that we need to worry about. And then once you get really good at it, you start realizing that all you're really doing is trying to improve your flows, improve your intervention protocols for these particular signs that come up often. And then as a professional, you might have to get creative with certain individuals where they have additional problems from maybe a surgery that means they can't bend one leg, so the exercise you were going to do, you have to kind of modify because they have to keep the other leg straight.
Yeah.
Or they have a limited amount of equipment, so now you're trying to figure out how do I affect this muscle with this one piece of equipment because they're not carrying a kettlebell home.
Yeah.
That's
a good point.
That's where the creativity comes in,
Yeah.
and like home exercise programs and stuff like that, getting creative that way.
Yeah. Okay, so with that, right, so this is a kind of a tough question. So I know that, so we implement corrective exercises, right, but what's the effect of that? Because we're only doing that training session, maybe, say we're doing 3 days a week, right, that's 3 hours. So how do we balance all that with normal life?
Okay, that actually brings up two really important points.
Okay.
Number one, you have to get outcomes. And your outcomes have to be driven based on reliable assessments. Okay. So whether it's the overhead squat assessment or like we were just talking about goniometry, which were probably my two go-tos.
Okay.
Overhead squat assessment is my binary, yes or no. Postural assessment, and then goniometry is my continuous interval measure. Okay. So I can measure progress. Yeah. And then of course we could add like a third sign if you have something like a concordant sign, where you know that if somebody reaches up overhead, their shoulder hurts, and that's what you're trying to correct, then okay, let's make sure that we do, like a quasi-near test if that's their concordant sign, and keep retesting that to see if we're getting better. Okay. All right, so we got those tests. The most important thing you have to do now is you got to assess, address, and reassess. And that's every session, multiple times a session. If you are doing corrective exercise right, you are getting a result now. Not later. Yeah. There's no way that a intervention that you created had no result in the session, but if given as a home exercise program, it's going to start magically working in a week. Okay. And I see that ridiculous logic all the time, especially in the fitness industry. Yeah. Just do this for 6 weeks and you'll get better. Yeah. No, man, you should be better now. Yeah. And that doesn't mean 100%, don't get me wrong. 50% is still improvement. Okay. Right? A 30% change for somebody who's really irritable, it's still improvement. But, you better make improvement. Yeah. Otherwise, you did something wrong. You missed something. They need some sort of other intervention. Okay. And I don't want to throw anybody under the bus. That happens, too. Okay. Any physical therapist, athletic trainer, chiropractor who says that they've never flared somebody up, or never completely missed a session is lying through their teeth. Okay. But, once if you keep that in the back of your mind and let's say you had a total miss or you flared somebody up and they came back, then what do you know to do? We have something. Something else, exactly. Right? It wasn't a loss. You didn't waste anything. You just need to try a different approach. And maybe that's go after a different sign on the overhead squat assessment. Yeah. Or maybe, you worked a lot on mobility techniques and all you got through was mobility techniques. Maybe you should work on the other side of things with activation and stability techniques, right? Okay. So maybe this is not so much a mobility problem as a stability problem. Okay. But once you find it, you got to keep going forward. Now, let's say you got a good result in a session. The next big things we need to think about are carryover. Okay. So there's some things that I think improve carryover. Obviously, a comprehensive intervention, I think, improves carryover a lot. So not just doing mobility techniques or not just activation techniques or not just IASTM or not just taping, but the combination of all of those things to address all tissue dysfunctions in an attempt to address a holistic system right? So we do that.
So sorry to stop you. What is IASTM?
Instrument-assisted soft tissue mobilization. So like Graston and Smart Tools and.
Oh, gotcha. Okay, that makes sense. Okay.
So you use all of those techniques. You create your flows to address all of your different systems, and hopefully get a good holistic approach. And then the next big step is you got to give them home exercise.
Yeah.
Because once the body learns how to cheat, it just wants to keep cheating
consistently. Yeah, it's a pattern.
So you have knee pain, and let's say knee pain seems to be pretty correlated in this particular individual with knees bow in on their overhead squat. By the time they leave, their knees bow in a little less. You found some dorsiflexion restriction, and that got better. And they had no hip internal rotation range of motion. That got a little better, and they felt better. Great. Now, if you don't give them a home exercise program, though, to reinforce that, what's going to happen?
It's going to regress.
Yeah, man. They just go right back to knees bow in. Because for whatever reason, body's like, yeah, but I was doing it this way.
Yeah.
I'm going to keep it this way.
Yeah.
So once you get the home exercise program going, I think that's where the reinforcement comes in.
Yeah.
And where I've gone as a physical therapist is essentially I'm doing manual therapy and guided exercise only to give them a head start.
Okay.
Maybe to get them back to no pain.
Yeah.
But it's the home exercise program that is the focus.
Okay.
Because they need to be able to self-manage.
Yeah. You're not going to be there every second of every day, so.
Or for the next 6 months.
Yeah.
And some initial research, and granted it's kind of like shaky indirect research, but I think a lot of us know this just from like practice. It seems to take like 3 to 6 months to like really get things to really start sticking. You know?
Yeah.
So I think being honest with ourselves as practitioners, it's important for us to realize that, like, yeah, you can get somebody to perfect, but now they need to keep doing that. Even though they're pain-free, they need to keep doing that.
Okay.
Otherwise, like, I could get somebody to perfect in, like, let's say 3 sessions.
Yeah.
If I don't give them a home exercise program, they're going to come back in a month. Maybe quicker than that.
Yeah.
Right? So I think that kind of answers your question, where most of my clients end up, since a lot of my clients do work out in the gym. I've trained a lot of personal trainers over my career, so I see a lot of personal trainers. I see a lot of personal training clients.
Yeah.
I would say the idea is, okay, let's get you on a home exercise program. If somebody's pretty irritable, maybe a couple times a day, right? Starting off with like 2 or 3 exercises. And then I try to build them into maybe a home exercise flow warm-up thing. Yeah. Right? Like a corrective exercise warm-up. And that becomes like an everyday thing, but maybe not twice a day at that point. And then what I generally tell them is, this is going to be your new warm-up at the gym. Okay. So the end product is, months after they've seen me, the only time they really need to do their corrective exercise is as a warm-up before they get into their other physical activities, and everything pretty much stays where it's at. Yeah. No, that makes sense. Okay. So let's talk about the next step, right, of multiplanar stability, right? So what's your approach to this? Because I know we can obviously do exercises in multiple planes, right? We can do stuff like that, but specifically rotation, right? So the body is not super equipped for rotation, and so, or to resist rotation at certain joints, right? So how do you attack that? I think I just work on doing exercises in multiple planes, and I'm big on the like anti-rotation thing for the spine. Okay. Less and less I do dynamic motion. I think sport pretty much trains dynamic motion as much as you need for the trunk. So like our 3 big core exercises are quadrupeds, which of course, and not just bird dog quadrupeds, but we have some pretty rough progressions. In fact, on my Instagram page, one of my clients and students came in, and he can now do lateral walking quadruped crawls with a ball on his back attached to a sled. That was like a beast. Yeah, that's next level stuff. Yeah, man. But every time he lifts his hands, right, like the torso wants to rotate, and of course, if he can keep this ball on his back, he can. So That's anti-rotation. I do a lot of static chops.
Mm-hmm.
I think chop patterns are great. And then, of course, we do bridges and all sorts of bridge progressions, including like hip thrusts and stuff.
No, definitely. Okay.
I would say those are our big three.
Yeah.
And notice, like, I didn't say crunches.
Yeah.
I didn't say Russian twists.
Mm-hmm.
I didn't say rotational throws. Like,
mm-hmm.
I feel like a lot of that stuff, it just gets trained against so much when they're doing their sporting activity.
Mm-hmm.
It's like, how much do you need?
And this is what I was trying to kind of get at a little bit. Like, what do you do differently than others might do? So keep pulling on that thread a little bit.
Yeah, so I guess one of the things I do is I train for balance, not for not to push somebody over the edge.
Okay.
You know, so for example, in the NBA, when I was with NASM had a lot of those NBA contracts. Mike Clark with Fusionetics still works with a lot of the NBA athletes.
Mm-hmm.
And you start thinking about, do they need power exercise?
Mm-hmm.
You know, like, do they need to jump higher?
Yeah.
Well, you go, it'd be nice if they could jump higher, but the truth of the matter is they're doing power exercise all the time.
Yeah, it's pretty much their sport, you know.
So overloading their system in the on-season may not get them better results. And that's the important thing to think about there. It's not, do power exercises make you jump higher, right? Or should a basketball player do power exercise? It's really, is this basketball player already doing so much power in their sport that there's nothing we could do that wouldn't just result in overload in their system, right? So if we added box jumps, like, is their body already adapting as much as it possibly can just from the power exercise in their sport? Now box jump is just, you know,
a little redundant. Yeah,
exactly. Redundant is a great word. So again, we go back to our outcomes. If we're working on an outcomes-based approach and we are setting up assessments in advance, and maybe for that, that's the we can do some sort of jump test, right? Maybe it is things like corrective exercise that's going to have the biggest benefit, because this person has, you know, right foot turns out, so they're asymmetrical and they have a dorsiflexion restriction on one side. Like, okay, let's fix that. Maybe what they need is more stability training, because, you know, power is great, but power without control is useless.
That makes sense. Okay. And then kind of moving forward, right? So I saw this kind of article, and I didn't necessarily read the whole thing, right? So it says, is all knee valgus bad, right? So they were using the example of like weightlifters, you know, competition level weightlifters. And so in some of them, you can see kind of a dip in the knees as they're squatting, right? So what's your take on this? Is all, I guess, I don't know if necessarily know if that does the article justice, right? But is all knee valgus bad?
Yes.
Okay.
Look, you're not going to be able to prevent all knee valgus at the highest intensities of sport.
Okay.
Right? So that's the first thing to think about. To think, like, if you look at, like, some early Blake Griffin highlights, he'll go up and dunk on somebody, and before he does, he's going into knee valgus pretty bad. The question is, like, could we ever do enough exercise to prevent that? Does that mean we should train that? Are you kidding me? We know, we have the research. We actually have a couple research studies that show knee valgus increases the risk of ACL tear. So, no. It's definitely bad that person does knee valgus. It's just, we hope that we can train them so that the knee valgus doesn't cross whatever that red line is that ends up in an ACL rupture. Same thing with powerlifters. Like, I'm not going to train a powerlifter in a knee valgus, but if they squat 700 pounds and their knees duck in at the competition, okay, like, what are you going to do about that?
Not much.
And the answer is nothing.
There's not much.
That's the very top end of their sport. They didn't get injured. Great. Right, let's just keep moving forward, keep reducing that risk by strengthening gluteus medius and increasing dorsiflexion and increasing inverter strength. You know, do all those things that make sure that knee valgus that they had in competition was the most knee valgus they're going to have, and we're not going to let it cross that red line.
That makes sense. Okay, So kind of moving forward with this, right? We've talked about the physical, and one thing that we haven't necessarily talked about yet is breathing training, right? So what's your approach to breathing training? Do you do anything for this, or do you have any resources that you like to rely on for this?
Great question. And the answer is no, I don't do a lot of breathing training.
Okay.
And here's why. I'm an outcome-driven professional.
Mm-hmm.
I want an objective assessment and a change on an objective assessment
mm-hmm.
to continue doing what I'm doing.
Yeah.
Subjective assessments,
mm-hmm.
like I'm in less pain,
mm-hmm.
are very sketchy.
Okay.
Although it's our goal to get somebody out of pain, or it's our goal to reduce somebody's complaint, you have to realize, like, and this is where some of the pain science comes in, you could have probably came in, got some good rapport with the individual, rubbed their back for 10 minutes,
mm-hmm.
and they're going to be in less pain.
Okay.
Right? As soon as they feel comfortable, as soon as they feel secure, as soon as they feel like they've made some sort of change, that placebo effect is no joke. Right? So
yeah.
placebo works.
Yeah.
With the breathing training, what I find is like, okay, I get why this is a good idea.
Uh-huh.
I get how the diaphragm interacts with the intrinsic stabilization subsystem and the transverse abdominis and pelvic floor and all that fun stuff.
Mm-hmm.
I get how the diaphragm might play a role in lumbar stabilization.
Mm-hmm.
But when I do breathing training, I don't tend to get the results that I'm looking for, whether it's an increase in lumbar rotation,
mm-hmm.
A decrease in pain during forward bending. I would even consider at least something,
mm-hmm.
right?
Yeah, yeah.
A decrease in pain during lumbar extension if somebody had low back pain. Even a decrease in thoracic pain, like
mm-hmm.
something, right?
Yeah.
Like I just don't see a change.
Mm. Okay.
So again, I think there is a place for breathing, and I try to integrate it at times,
mm-hmm.
but I've never found it to be a very large topic.
Okay.
In my stuff.
Gotcha. Okay, so then what is your take on things such as PRI or even the FMS breathing course? Are you familiar with any of the resources?
Okay, so we got to be a little careful here, because what you just did was pit me against another organization, and I don't know these people, so
okay.
That's a little unfair.
Okay.
Obviously, I'm going to have my biases.
Yeah, yeah.
If I thought PRI or FMS was the number one thing out there, I'd go work for PRI or
mm-hmm.
FMS, because it would be a lot easier than building my own company.
Yeah.
So realize that I have my own biases.
Uh-huh.
Obviously there's some philosophical differences between the FMS and the Brookbush Institute.
Yeah.
They tend to go at correction, systematic, or what's the word I'm looking for? They tend to use like multi-joint approaches, and I don't think you can use a multi-joint exercise until you've corrected single joint, like muscle by muscle stuff, because
mm-hmm.
you have things like synergistic dominance and relative flexibility. So
yeah.
you kind of have to fix the pieces before you go and fix the puzzle.
Yeah.
What I've seen from PRI is a lot of very low intensity techniques.
Mm-hmm.
And I think some of it would probably be great for somebody who's very irritable.
Mm-hmm.
I don't think it's very appropriate for an athlete who's having a little bit of low back pain.
Yeah.
Right? Like I've seen some stuff with like balloons and lying on your back and, stabilization in prone with feet up against a wall.
Mm-hmm.
And my thinking process there is, okay, somebody has a little bit of low back soreness after playing a 48-minute game where their defensive assignment was 260 pounds,
mm-hmm.
right, and was running at them full speed, and now you have them lying on the floor. Like, that's not going to be intense enough to get an adaptation.
Mm-hmm.
What are you trying to do? So mm-hmm. that's where progressions and regressions come in, of course.
Yeah.
Like I said, I don't know PRI enough to just say, like, it's too regressed. It is probably very appropriate for a certain population. I think in the fitness world, it's probably not appropriate for most of the individuals I've seen it used on.
Mm-hmm.
And then again, with the FMS stuff, the way we go about addressing movement impairment is just very different.
Okay. So last couple questions here, right? This is more about you and your development. So what are some resources that have had a big impact on you?
Okay. Are we talking about human movement science, education, or business?
A little bit of both, or whatever like the top out of each category would be.
So human movement science, obviously I'm big on movement impairment. And so, individuals like Yonda, Sarman, and of course Mike Clark at NASM had a huge influence on me early on. Now, I read a ton of research.
Okay.
So I have a writing team. We're continuously publishing content. I personally publish a textbook's worth of content per year. We're talking 250 plus pages with, probably better than 1,000 citations on a yearly basis.
Okay.
And I've been doing that for a while.
Yeah.
So that's probably where I get most of my information now.
Okay.
As far as education, I'm very much a part of the education technology disrupt. I think there's a huge democratization of education that's happening right now, and I'm very happy to be a part of it. I think post-secondary education is ridiculously expensive, horribly inconvenient, and it's centered on the wrong people, which is generally everything is to make the university happy or the university professor happy rather than the student. And I think learning needs to move to student-centered. Education is one of the few things where the student is going to pay $30,000 a year for a product.
Yeah.
And that product walks in and tells the student that just paid, okay, here's how you're going to make me happy. Right? Like it's just a wrong mentality. And even worse than that, if you really think about it, it's $30,000 per year or whatever. You walk in for this product that you're getting from a university, and the university professor is seeing very little of that. So are they actually going to deliver $30,000 worth of value? Probably not.
Yeah.
In fact, some of the, with universities moving towards research first, and the fact that you can become a university professor with almost no knowledge of education science at all, it's very common for classes to be taught really poorly. Now, don't get me wrong, there are some great professors out there.
Yeah.
There are wonderful teachers, I'm sure, at every university. But it's not most.
Yeah.
I'll say that. I'll go on record and say most teachers at universities are not great.
Okay.
Most teachers at universities are not giving that value. I think now that you look at, take the Brookbush Institute, you have a geek like me who's trying as hard as he possibly can to provide optimal education. Right? I've built a whole team around this. I have web developers and writers and instructors and instructional design consultants and all this other fun stuff going into this. And I can do that because thanks to technology, I don't have to tax 30 students for $20,000 a piece.
Yeah.
I can charge thousands of students $20 a piece. Right? So all of a sudden this solves all sorts of problems.
Yeah.
Right? You have one guy eventually getting paid well. Unfortunately, I still reinvest everything into the company. But eventually I'll get paid pretty well, which hopefully I'll deserve it. Yeah. Right? Because I've lived up to the hype, I guess you could say. I've given the service the value that I'm getting paid. And the student doesn't have to pay as much because I'm able to teach so many people through the technology aspect. So now the lower price tag also increases access.
Yeah.
Right? Like we offer, to give you an idea, there's 600 articles, almost 100 pre-approved continuing education courses, a certification, almost 500 videos on our platform, right? We charge $19.99 a month.
Wow. Yeah.
That's it.
Comparatively, that's crazy.
Yeah, so you have all of this.
Yeah.
Right? And you can access all of it in whatever order you want, which gives you guys the choice again, right? Not to mention, we're able to do some really cool stuff. Like, we have an app.
Yeah.
Right? The app makes it all, you can do all of it through your phone. So it's totally modular too. So, our courses are all 1 to 4 hours long.
Okay.
Right? We purposely did that so that you could essentially do a course in a cancellation.
Yeah.
You could do a course at lunch. You could do, maybe one of the 4-hour courses takes you a couple of commutes. Like, that's what we were thinking. So you can do all of this stuff. We can keep working on all of this stuff. We can keep adding new technology. And it's all because of this democratization of education, which is fantastic.
Yeah, yeah.
And I hope eventually that the courses that you take that are already right now continuing education approved and counting towards your human movement specialist with the Brookbush Institute, which is our certification. All right, so our courses count for both of those as soon as you start, and we're keeping track.
Okay.
It'll also hopefully in the future count for master's degree credits.
That would be awesome.
Right, so this is where we're headed. Like, when you really think about it, a certification, a degree, they're just rubber stamps.
Yeah.
It's all the content's the only thing that's actually has value.
Exactly.
Once we have the content, like, why can't we give you credits for all of these things at the same time?
Yeah.
And just, it does, like, a master's degree is just a comprehension of a certain amount of content.
Exactly.
Well, great. We'll make you go through that much content. I'm not trying to make it easy.
Yeah.
Per se. Right? I wanted to make it more accessible. I want to make it more convenient. You're still going to have to know what somebody with a master's degree knows at the end of the day.
Yeah. But yours might also be more relevant,
Hopefully.
Yeah.
Hopefully, if I can get a writing team that continuously updates these modules, and it'll stay much more current. Of course, that gets into like business discussions, which we do run a lean company, and lean is actually a management strategy, and we work off something called agile as well.
Yeah.
And so it's all about these like small batch iterations, which hopefully will keep us, like you said, far more up to date and growing at a much faster rate as far as the amount of content we can produce.
Yeah.
Which are all these are new technologies in management, essentially. So if apps are new technologies for computers, like lean is something that started off a long time ago, but now it's grown some serious legs with the technology industry on how to manage these things.
Okay. No, that makes sense. Okay. That's awesome. And then kind of moving into this last segment here, right? Just a couple quick rapid fire questions. So if you have any, what are some quotes or mantras that you live by?
Good one. See a need, fill a need. I think I learned that one from that Pixar film Robots.
Okay. Keeping it simple. I like it.
If you're not living a life in service to others, then what are you doing? I think that's a Zig Ziglar quote.
Yeah.
What else? You kind of hit me on the spot. Now I'm like, I know a lot of quotes, but now I'm like trying to think of ones that are good. I don't know. Man, there's one from The Tale of Two Cities, but that's a pretty dark one. Having something to do with, on every path that leads to the future, there's 1,000 men to guard the past. The best that the least of us can do is not add to the immense dead weight that nature drags behind her. That's pretty dark.
Yeah.
It is one of my favorite quotes, though, because it just reminds me, like, when all these trolls come out and all these contrarians come out, and all these individuals who like to throw stones at a guy like me and others in the industry who are trying to push forward. You just look at it and go, yeah, these are the 1,000 men to guard the past. Like, forget them. Let them go.
Yeah. Okay. Awesome. And then the next... Oh, go ahead. Sorry.
I was going to say next question.
Yeah. So is there a thought or experience from your past that you have held on to that has made a big difference in the way you live your life now?
Oh, man. See, we could talk for like another half an hour. I've had some pretty rough things happen. I've definitely not grown up with like a silver spoon in my mouth or a lot of opportunity. I've grinded.
Okay.
Like that's I think the most important thing that I've ever learned, and maybe this comes back, like I started off as a jazz trombone player, is that whole concept of delayed gratification and practice and intention to get better every day eventually gets you to pretty remarkable places.
I like that. Okay. Fair enough. All right, so then next question is, what is the best advice you've ever been given?
Best advice I've ever been given. I don't know. I've gotten a lot of advice over the years, I guess.
Okay.
I dig deep. I mean, is like a mantra for me. Like, I feel like you got to grind it out. You know, like there's a rise and grind canvas on my wall here in my office.
Yeah.
Like understanding that is important. I think when you start reading about other entrepreneurs, you realize 8 hours a day isn't going to get you there.
Yeah. Agreed.
If you're working a 40-hour week and complaining that you don't have millions in the bank, like, shut your mouth.
Yeah.
Like, you don't deserve millions. Those who get ahead are the guys who are working 80, 90, 100 hours a week. I mean, I don't remember the last time I worked definitely less than 70 hours in a week. I can't remember. And I would say on average, 80, 90-hour weeks is pretty stable.
Yeah. Interesting. Okay. So what is the worst advice you've ever been given?
Anything having to do with faith and it'll happen the way it's supposed to happen and, it'll all work out in the end. No, it won't.
Okay.
And I hate to be so dark about that, but like and there's obviously a place that those things make sense. I shouldn't totally shoot them down, but if you want success, you're going to have to engineer it.
Yeah.
There's no handouts for most of us. Yes, you hear about the lucky breaks, and I see it in my industry, in the education industry. I'll see that like what I'd call random ass workshop, right? That like puts some fancy title and goes blockbuster, packing out 60, 70, 80 people per workshop for a while.
Yeah.
Trying to predict how to make that happen is probably not going to happen. Most of those end up being flare-ups where they're successful for a couple of years and then they totally die out.
Yeah.
For the rest of us I would say for the 90% of the individuals who managed to build successful companies, it wasn't luck that way. I mean, we all get lucky. If you have a successful business, you have a lot to be grateful for, but you got to engineer growth.
Yeah.
Every day, feel like 100 things are trying to push you back, and you got to find the one way to take a step forward.
I like that. Okay. No, that's big. Awesome. And then kind of this last question here, you touched on a little bit with the, the having your credits count for master's degrees as well, but what other projects are you currently working on, if there's any more, and how can people kind of reach out to you and follow your journey?
Yeah, so I'm on Instagram, Facebook, YouTube. Those are probably our biggest platforms. Obviously, BrentBrookbush.com, man, for $19.99 a month.
Yeah.
I have to say, as biased as I am, I still am not sure why everybody hasn't signed up.
Yeah.
I set out to build the education platform I wish I had coming up, and I think I'm getting close.
Okay.
So, and for the price tag, like there was just nothing like that 5 years
that's
ago.
crazy.
So,
okay. Awesome.
As far as what we're working on, man, like I run a company, so I'm working on. Sorry.
Yeah.
My killer chihuahuas guarding the door.
Oh, no worries.
Good way to end. I guess he's guarding whatever's coming up. But I would say, as far as what we're working on, we're going to make technology better. We're going to get better content out there. We're working a lot on the performance side right now. You'll see a lot more physiology and program design from us coming up.
Okay.
A lot more manual therapy, though, too. We're working on rebuilding the app for a third time, reducing load speeds to almost nothing.
Yeah.
And we're hoping to just continue in the vein we're going, where more and more certifications, more and more college credits. Like, we already have a really good relationship with Concordia University, so our stuff doesn't count as college credits right now, but they use BrentBrookbush.com as a textbook for 4 of their courses, and they use our courses as assignments. So if you finish the courses before you go into that degree, you already have your assignments done.
There it is, yeah.
It's kind of insane. And we're just going to keep heading that way. Of course, we're also doing live workshops. We'll be in, I think, 20, 25 cities next year. So
yeah. Fantastic. Awesome. Well, I love the stuff you're doing, you know what I mean? You're probably going to get a new subscription here soon, so look out for that. Appreciate your time. This has been really eye-opening. You know, there's a lot of cool things, and I really am excited to dive into it. So once again, thank you for your time.
Absolutely.
All right, I will talk to you later. Thank you. Thanks again for joining me, and if you enjoyed the podcast, please head on over to iTunes and give me a 5-star rating and or write me a review as well. Next week we'll have another exciting guest. So until then, this is the Gamut of Performance Podcast.